advertised with the whole standalone event, but it will pick up a lot of our university programs have really picked up quite a number of views after posting to YouTube. Like that one that Lee and I did on vaccines has well over 1,000 people who've watched it now.
That's great.
Rhea or Alex, do you mind just texting the audience, chatting the audience that they can post questions and welcome and telling them we'll start on the hour and everything? And I guess everybody should now go mute and turn off camera, except for me.
Robert, we have 64.
Oh, okay, that's great. I don't see that.
Well, 64 registered doesn't mean they all show
Oh,
up.
right. Okay. Yeah. Okay, that's good. That's actually a quite respectable number. We usually get most of our views on Facebook, sadly, but since Facebook is down all over the world, which must make their day very stressful, we won't get those views. But we're starting to pick up views on Twitter and YouTube too. So. So Roger, you should also turn off your camera and mute. Is mine still on, Colin? Yeah. Okay. Well, I guess you're muted too.
I don't believe so.
I think it looks like it's on to me.
Oh yeah.
You'll just in a moment have to go back to
yeah, actually your camera is on.
It looks like it's on to me.
Yeah,
okay.
your camera is on. I can
in a moment have to go back to
yeah, actually your camera is on.
It looks like it's on to me.
Yeah, okay. Your camera is on.
Okay. And maybe just Colin, send a chat when you want me to officially start or something. For those of you who are joining us, we will be starting in just a moment. We're just waiting for a few more people to come on to the Zoom. So thanks for joining us. We'll get started in just a moment. Great, I'm glad all the live stream stuff is working, because sometimes people register, they lose their link, so it's nice they can watch on. They can watch without registering too. And we'll get started in just about a minute. We just don't want to start early because lots of people log on just kind of right as the hour turns. Oh, okay. So I think that looks like we are good to go. Nice to see you, Michael.
Yes, I need to unmute. Nice to see you, okay. Robert.
Sure. I'm going to start us off, and then we'll start talking, just to give people a little bit of context. Aloha, everyone. Thank you for joining us. Welcome to the Hawaii Book and Music Festival. My name is Robert Perkinson. I'm a professor at UH in American Studies. I'm coordinator of UH's Better Tomorrow speaker series, and I will be your moderator today. Today, we're going to be talking about UH off campus and in the community. Research universities are big and complex institutions, and so they have an array of community impacts. We educate students, of course. We train them for jobs that exist now. We also train them for jobs that no one has dreamed up yet, which is a really important role that universities serve. We equip students, I believe, to lead richer cultural lives, more thoughtful lives, to contribute in healthier ways to the functioning of a democracy, as we have learned recently is rather important. Research universities, another pillar of them is that they generate new knowledge. And that means we nurture all types of inquiry in all sorts of fields. Sometimes this means managing massive research grants All of this helps us understand how the world works scientifically, culturally, socially, and also lays the groundwork for innovation of every conceivable type. And that's why new industries, from the late 20th century forward, typically sprout up around research universities, just like Silicon Valley did around Berkeley and Stanford. Those twin pillars of the university, teaching and research, keep the economy humming. They're directly responsible, according to UHERO estimates, for some 23,000 jobs in Hawaii, many more jobs indirectly. But it's also important to realize that there's a third role that universities play, and that is helping solve public problems. From economic forecasting to emergency deployment of public health and public health workers, to localized climate change mapping, to agricultural extension agents that are sent all over the state. A research university like Manoa isn't just having an impact through its activities on campus, it's also doing community work directly from Hilo to the Northwest Hawaiian Islands. And our topic today is UH in the community. And we have three guests. First, Michael, who's here with us already, the provost of UH Manoa. Later, we'll talk to Judy Lemus, who's the interim director of the Hawaii's Institute for Marine Biology, or HIMB, who's just gone on sabbatical. And also Lee Buenconsejo Lum, who's the associate dean of the John A. Burns School of Medicine. A note on format. We've been harvesting questions online and we will work them into the conversation, but we also want to hear from you now. If you are joining us on Zoom, you can post questions and comments in the Q&A module, and we'll do our best to respond to them. If you're watching on YouTube or Twitter, probably not Facebook today, then you can post there as well. And we have students who are helping us monitor those channels as well. Before I start talking to Michael, I just wanted to say that he is not just the provost of our flagship campus, but also a respected scientist, the author of more than 100 technical publications. He got his PhD in civil and ocean engineering from MIT. He has a new book out, The Urban Ocean, which is actually directly related to many of the topics we are discussing today, as it deals with all of the complex ways that coastal cities are shaped by their ocean environments and how we can better manage our relationship to those ecosystems, especially in this age of climate crisis. Michael, there's been so much attention to the institution managing COVID that many people may not have realized that according to our primary traditional metrics, there's actually a lot of good news at Manoa. And I just wondered if you might tell us some of those surprising numbers, or at least they may seem surprising to some, like, for instance, with respect to enrollment.
Yeah, thank you, Robert. Thanks for those kind words. Yeah, the message coming out of Manoa is really entirely positive. By all of the metrics by which a university judges itself, we are doing extraordinarily well. Even through this pandemic, we have an enrollment of 19,100 students this fall. That is the largest enrollment that we've had at Manoa since 2014. Even more impressively and very important, we have the largest entering class in the 114-year history of the university.
Wow.
Yeah, so just amazing. Of course, we want to now retain them and move them to graduation, but our numbers in terms of retention and graduation rates are also going up, as are all of our rankings across all of the domestic and international rankings. So yeah, we're doing terrific. And I think we'll talk about research and other areas as well, but certainly.
Yeah, I mean, go ahead.
Just it's a great story on enrollment.
That is good news. Yeah, we are seeing it in my Department of American Studies, just in class enrollments, that classes are filling a little faster, and it's good to see lots of enthusiastic faces in 2 dimensions or 3. Fundraising, which a lot of that has been in response to COVID, providing student assistance, that's also up overall. Is that right?
It is. I can report on behalf of the UH Foundation that if we removed the 2 years in which Jay Scheidler gave extraordinary gifts to the university, if we remove those 2 years, this past year was the strongest fundraising year in the history of the foundation. So again, and that, you know, it's what's most incredible to me is that like enrollment, UH Manoa is bucking a national trend. We're seeing an increase in our numbers in terms of total numbers of donors and in terms of the actual fundraising. We're up 16% from the year prior to the pandemic, and that year was up 29% over the year before. So, you know, again, just like enrollment, Manoa is seeing continuing year over year, and we are totally outperforming our peers around the nation.
And that's, I understand our total kind of research budget, all of the grants that come, some from the federal government and private foundations, is that also at a record or close to?
It's right there at a record. Manoa faculty, hats off to the faculty and their supporting staff, brought in a total of $358 million in external funding to the campus. And we all know by extension, that means to the state. That number is a record number, except for the Obama stimulus year, where there were billions of dollars fed directly to university campuses. If we remove that year, this past year was an all-time record. Pretty good news across the board, don't you think?
Yeah, that is encouraging, especially because, yeah, we have been through a thicket, to be sure. You know, you mentioned the Obama stimulus package. There have been a series of federal rescue packages in response to COVID and the related economic crisis. Those were supposed to insulate vital state agencies, including UH, from budget cuts, and yet we got kind of walloped by the legislature anyway. So how well do you think we are able to manage that cut, and how optimistic are you that we will be okay, you know, in the next couple of years?
Look, it's no secret that we were caught completely by surprise by the legislature's actions with regards to the Manoa budget. We all expected that the university system could very possibly take a budget cut because of the dire consequences, the really significant fiscal impacts, financial impacts of the pandemic here in Hawaii. We never dreamed that the legislature would choose to disproportionately cut the Manoa campus. That's a very strange thing. I still don't have an explanation for that, although I've asked. And we're hoping that either the legislature in next year's session or we will internally make that right, because, you know, it comes at a time and in the same year in which we broke all these records. And I think people understand that in order to perform research, you need people, you need support staff, you need supported students. In order to support these dramatically increased enrollments, you mentioned in your own department, I mean, across the board, departments are having to put up new additional sections more than they have in the past. That means either assigning additional workload to existing faculty or hiring lecturers. We've had a hiring freeze. We're just going to start hiring faculty, but that's really for next year. So the departments and the schools and colleges are having to deal with essentially what is a good problem to have, but the state's, I think, unfair treatment of Manoa really hit us hard. Having said that, we have a plan to get us through this fiscal year and next fiscal year. A lot of that plan involves the use of these one-time funds from the federal government, as well as a lot of program changes that we are doing and retooling at the administrative level. We've reorganized the campus. We are reorganizing a variety of units and programs taken together. That's going to put us in a much stronger position. But, we worry that these cuts, like they often do, will become permanent. So that's a worry for us going forward. And we do hope that there'll be some new thinking and new approaches to, in particular, the Manoa campus.
Yeah, folks should know that the total amount of money also that we bring in for research dollars is roughly comparable to the total dollars allocated by the state. Is that right?
Yeah, that sounds right about right. And we have to,
which makes it a good bang for buck agency is my point there.
It is, because
among many other reasons.
Yeah, those dollars, each dollar that's brought in via research grants has associated with it other dollars that are leveraged by the faculty. So, and those dollars go into hiring people who then pay taxes. They go into purchasing supplies, which goes out into the community. Yeah, it's as UHERO has done many studies that have pointed to those impacts across the community.
When people picture massive research grants, I think they typically imagine, like faculty and grad students in labs working with spectrometers or supercomputers or something, and we do all that. But some of the biggest grants we get are specifically to fund direct community service and kind of studies that have a direct community impact. And I just wonder if maybe you might spotlight a couple of those as we're emphasizing that sort of UH community impact today.
Yeah, it's a good point. A great example I'll point out is a recent $15 million grant. That's a $15 million grant spread over 5 years that came to us from NIH to establish the Center for Pacific Innovations, Knowledge, and Opportunities. The acronym is PICO. And the purpose of this initiative is to improve the health and well-being, the healthcare outcomes of Indigenous Pacific people, meaning Native Hawaiians, Pacific Islanders, and Filipinos. So that goes right to the community and right to the heart of some of the real high-profile, impactful health disparities, healthcare outcome disparities that exist in Hawaii. One other one I'll mention, many of the folks on this Zoom might be aware of the Cancer Center, the multi-ethnic cohort study that has been going on for decades in following people of various ethnic backgrounds, various ages, and locations here in Hawaii and in Southern California, and looking at, again, healthcare outcomes, particularly related to cancer among this what we call a cohort. And they just received, again, continuing funding, nearly $4 million to continue that important work, which, by the way, is known internationally. Super important study for the health and well-being of our community, and by extension, the health of really the world when it comes to cancer outcomes.
UH has certainly been a leader in that kind of multicultural and multi-generational approach to medicine, which is changing a lot of the way studies are designed and treatments protocols are developed. We also stepped up to an extraordinary degree, I think, in response to COVID-19 from January 2020. It's now so long ago, I'm having a hard time keeping track of my pandemic years. but we're heading up on 2 years of this crisis. And it's been a wild ride for all of us, a tragic ride for many. But I just, as we enter our second year into this crisis, I just wanted to have your sense, generally, your assessment of how you think the institution and all of the people who make it up have done.
Well, I'm going to try and not steal the thunder from our Associate Dean of the Medical School, Dr. Buen-Consejo-Lum. I know she's going to speak in some detail about our response on COVID. I'll just say this. We know that the Manoa campus has been the safest place to be on Oahu, and that is because of the fantastic work of our healthcare professionals, our faculty, staff, and students themselves in taking personal responsibility for the health, not only of themselves and their families and loved ones, but also each other. And I think that's borne out in our numbers. We're just around 100 cases on the Manoa campus since April of 2020. Think about that. Most university campuses have way more than that every week. So we're really proud of that. And again, it goes to the care and the caring of our faculty, staff, and students. Our faculty pivoted very quickly to online learning. I know for a fact that as time has evolved, as we have deployed more advanced tools and also training, the faculty have gotten quite adept at this. But at the same time, we are slowly seeing more and more of that instruction coming back to in-person. I have been routinely approving individual requests from faculty to meet with their classes, usually in the outdoor environment. And so hats off to our faculty for continuing to evolve their teaching as the pandemic waxes and wanes. And also a real mahalo to our students and their families, for their patience, for their diligence in continuing to learn despite all these hurdles. We hear all of you and your questions, your concerns. We are tracking towards a largely in-person spring. There will still be some online instruction in the spring. We've been asked to ensure that by many in our community, but the vast majority of instruction is going to move to in-person.
Yeah, it's been hard for students, especially new grad students or new freshman students who show up and haven't really ever had that full social experience of being at our campus. But I've been impressed with my own students, both grad students and undergrad students, how well they've adapted and are figuring out ways to thrive. And how well they've had to just grapple with all sorts of things, getting moved from the dorms into a hotel because they got exposed, or they've had to roll with it for sure. Yeah,
we are hoping that some of the restrictions will ease up now that our cases per capita basis this morning we're as low as California. So that's a dramatic improvement.
Well, writing the downside of this Delta wave does bring an elephant in the room into view, which is athletics.
Ooh.
The elephant happens to be doing a bit of a victory dance at the moment from homecoming, so that's kind of welcome news. But first of all, what's UH's case for why you believe that UH can invite spectators back safely?
We believe that the plan that we have will guarantee that our new stadium, which nobody has yet seen, will be actually the safest place on Oahu at which to watch the game. Much safer than being in a bar without a mask, surrounded by people whose vaccination status you may not know, or they may be tested, but we are guaranteeing that every fan at our events will be vaccinated. We're
And
guaranteeing
it's outside.
it's outside, and they will be wearing a mask. So, every healthcare professional, including Dr. Buen-Conseil-Lum, has said this will be as safe an environment as you can possibly have. And she may speak to that. I know that she and others on our health and wellness team had a very good meeting with the mayor and his advisors, and the mayor is supporting our plan. It really is just now up to the governor to just, let's follow the science. It's time to allow fans. And now, we're in a situation where we have 3 weeks between now and the next home game. So I expect our numbers will go down even more, and hopefully the governor will look at our plan and agree it's a strong one.
Yeah, the 3 weeks those 3 weeks should help.
It would have been nice. It would have been nice to have families of the players at that.
At least that, yeah.
On Saturday.
Yeah.
So that's a disappointment, but we move on.
Okay, well, let's move on to another crisis that UH is rallying to meet, and that is climate change. This is the challenge of our time, even if COVID is the challenge of our moment. And UH has really just pivoted across over the last decades, really, across so many disciplines to be deeply engaged in basic scientific research related to climate change, but also really granular forecasting and all sorts of climate initiatives that are really critical to formulating mitigation policy in Hawaii. So there also are some, I think, significant new research grants that have been announced. So I just wonder if you might tell us a bit about those, just so people have some thumbnail sense of some of the exciting research that's going on across all the spectrum of, greenhouse gas emission controls as well as mitigation in the state.
Yeah, I'm always cautious about singling out specific faculty and units. Yes, our Hawaii Natural Energy Institute, our Sea Grant program, our law school, they have all been very successful in bringing in funding, as has our Institute for Sustainability and Resilience. But really, Robert, it's, in addition to the Institute, it's SOEST, the College of Social Sciences, agriculture, architecture, even our law school. We have faculty across the university, probably in much bigger numbers than other universities, examining climate change and the impact of climate change on Hawaii. I think the one thing I want to say about all this is that I'm super proud. It's so impressive that all of this work is really applied. It's really, as you said, granular, digging in and addressing real world impacts on Hawaii. And by extension, then that can educate the rest of the nation and the world. We have 3 faculty who serve on the City and County's Climate Change Commission. We have Professor Maxine Burkett right now working in the Biden administration as an advisor to former Senator and Secretary John Kerry in this area. Faculty working on the ground with the city and county, with the governor's office, with the legislature, and hats off. By the way, I know I complained earlier about our budget from the legislature, but I have to take my hat off to the legislators and to the mayor and his team, and also to the governor. They have established an environment here in Hawaii where our faculty are welcomed in to bring their expertise to play in the real world to help address some of the impacts of that we're already seeing in Hawaii, and develop mitigation strategies and planning strategies, et cetera.
As provost, Michael, you have the pleasure, I reckon, almost always of highlighting all of the exciting work that's going on across campus. in so many different fields. If sometimes there's the peril of leaving out something that's really important, as will happen inevitably every time in a institution this complex. But you don't very often get to talk about your own research. But I was looking at your book last night, The Urban Ocean, and it just is really so vast in covering all of the challenges and complexities of coastal urban environments. And I wonder if you just might say a word about it, and some of your hopes about how Honolulu might meet its ocean environment challenges in the coming years.
Okay, but very quickly, because I want us to go to our other speakers. I don't like talking about my stuff too much. So connecting the dots, I'll say that the book is intended to be a call to action. We try really strongly to message the fact that the world at large is becoming more urban. People move to cities because cities are the places where they have opportunities, economic opportunities, social opportunities. Most of the big cities are located on the ocean for a lot of good reasons: trade and food sources, recreation, etc., better climate. But those are the cities that are most threatened by the impacts of climate change, like sea level rise, loss of groundwater, and ocean acidification, its impact on the coral reefs, and then fish population. So it's that confluence of factors. There's more people now living in harm's way because of climate change. And we need to, as citizens of urban areas, we need to take a close look at what we can do to prepare for the inevitable and mitigate those impacts.
Okay, thank you very much, Michael. We'll try to kind of bring you back into the conversation at the very end, where we'll try to ask everybody to look forward to what their hopes are for Manoa's community impact in the coming years. And now I want to say farewell to you temporarily, and then bring on Judy Lemus, who is the specialist faculty at UH, which I should mention is a kind of unique classification of faculty that some other universities don't have, in which the holders of these positions are especially charged to engage with the community and solve public problems. Until she went on sabbatical a little bit ago, she was also the interim director of the Hawaii Institute of Marine Biology, which includes Moku'ulo'e, or Coconut Island, the research facility that maybe some of you have taken your kids to or visited before, as I have. She's an expert in marine symbiosis. She also supervises a host of collaborative research, education, and outreach initiatives. So it's really nice to talk to you today, Judy.
It's great to be here. Thanks, Robert.
Well, just so people have a sense of all the diversity of research that goes on at the UH, maybe I'm curious to hear a tiny bit about your own research. I think you deal with squid bacterial symbiosis, and then we'll turn to UH community symbiosis after that.
Sure. Yeah, and I will just mention that this is an area that I have done work in, but I'm not currently researching it. But it is such a cool system that I'm glad that you asked about it, because it the system is the Hawaiian bobtail squid. It's a very small little squid, about walnut size, and it lives in a symbiosis with bacteria that make light. So what we call bioluminescent bacteria. And they use that light actually to camouflage themselves in the nighttime ocean when they're feeding. And that system ecologically is very cool in itself. But one of the other reasons why it's really important as a study system is that it actually helps us understand how our own tissues as a multicellular organism, what we call eukaryotes, interact with bacteria, because that system is so specific, and we can take the bacteria away and we can give it back to the squid. And so there's a lot of research actually being done by other labs at UH Manoa trying to understand the dynamics of that system. And so it's just a really wonderful example of how a local organism is really providing a lot of information about much broader issues in terms of our own physiologies with bacterial systems.
So I presume this, even though you've been doing very important administrative work, I presume this research is continuing. How was it? How did HIMB generally cope with the disruptions of COVID to keep the research enterprise going? Because I suspect that you'll speak for a lot of faculty across campus in explaining some of how you made the transition.
Sure, yes. I think pivot was a good word that was mentioned earlier. And so I'll just say a little bit about what HIMB is and does, and then I can kind of tell you sort of how we addressed some of those things. We are a research institute that studies everything from marine bacteria to marine mammals. And we really focus on the ecosystem health of the marine environment and our associated coral reefs. So we are looking at sort of the ecosystem health on the ocean side. And interestingly, for a research institute, we actually have 4 faculty education specialists. I am one of them, but we actually have 3 others as well. So we really integrate research and education in our programming. We do have researchers that do very basic and applied research, and then we have educators that actually take that information and apply it to some of our educational programming. But in terms of our research enterprise, one of the really big impacts for us was that we do a lot of diving. So we have to get in the water to do our research. And COVID really actually impacted that quite a bit, because when you're diving, you're in a boat, you're usually in a smaller boat. We do mostly coastal research. So we're in a small boat in close approximation to other folks. And early on, that actually really impacted our research. We had to pivot. Our diving operations were actually suspended for a while. We needed to sort of work on other kinds of field activities. We worked on lab research. A lot of our researchers focused then on the lab aspect of their own work, but rotating people through their labs so that we didn't have too many people at once all in laboratories, until we really started to develop, and UH was really instrumental in this in terms of providing guidelines on a continuing basis for how we actually can all safely interact with one another. And so we eventually got around to continuing our field research. We're back at diving. Everyone is very productive again, and we're really glad to actually be out on the water and in the community, because the other impact that we had was that our education programs that happen both in person on Moko'oloi, but also in the community, were heavily impacted. And so we did a lot of pivoting in that sense.
Well, I'm glad to hear that you're figuring out how to come back together and continue that research. I know that on the education side, you've also been working on some initiatives to, make the educational experience rich through digital technology in a way that might at least take us a half a step toward the in-person experience. So I was just wondering if you might tell us a little bit about I know you're working on an iPhone fish pond app. So what is that and what is it supposed to do?
Yeah, that project is a few years old now.
I figured it was a coincidence.
Yeah, yeah. It just, but what I think it actually gives a good example of how researchers and UH Manoa has in general adapted our programs. So we had an in-person internship program at a local fish pond, at a local Hawaiian fish pond, He'ea Fish Pond. And this was an in-person research internship. And it was very rich. We ran it for 3 years, but not a lot of people got to participate in it because we had to keep it fairly small because of the intensity of the program. And at the end of that, what we decided was, how can we actually extend that reach of that research experience and being out here in this wonderful native Hawaiian fish pond in this environment to a broader community? And so what we did was we developed an app. It's on the iPhone. And it provides you with sort of a virtual tour. You can download it from iTunes, and it provides you with a virtual walking tour of the fish pond. And so that was kind of our first foray into those digital technologies and making very place-based programs accessible more broadly. And then we've actually been exploring some new ideas as well. Our community Center for Community Education has been developing a really cool system as well.
There's a way, has it launched yet? But there's ideas for a way for people to visit Moku'olo'i without taking the boat across like they typically have to do. Is that operational?
It's not yet operational, but it's close. Okay. It's in development. And this is something that actually did truly grow out of our pandemic situation, because our community education programs were pretty much completely shut down. We weren't having any visitors on campus. We do have somewhat of an online presence, but this was a real opportunity for that faculty member and our Center for Community Education to really think about how do we improve access more broadly to the place, because we really strive to make our education programs place-based and integrating our research and our education. So the education programs came up with this new interactive virtual reality tour of Moku'olo'i, in which people can sort of take a deep dive into different areas. You can actually, through your screen, you can actually walk the island, and then you might visit different places of interest. And within that place of interest, say like our coral farm, you can actually then click on some deeper information about the corals that are growing there and what's happening, or the fish that are there, or maybe you might take a deeper dive into the shark research program. So it's really exciting. It's really going to increase our access to HIMB, and it's also actually going to kind of bring us full circle, because some of the high school Marine Science Club students that program is working with are also going to be able to actually create content for it. And so we're doing so the students are becoming the educators and for other students and learners.
I wanted to ask you one other question about a multifaceted program, and that is the ecosystem restoration around the He'eia fish pond that you're working on. That it seems like it has educational components, research components, Native Hawaiian cultural development components. So I just, I'd like you to tell us a little bit about that project and what makes it unique.
Sure. Yeah. It is the newest of the National Estuarine Research Reserve System. So that is a nationwide system. I think that there are about 30 of those centers around the U.S. in the coastal regions and Great Lakes. So He'eia was the most recently designated, although I think that there's one being designated now again. And that was back in 2017. And what was really, I think, important about this and the resilience of that program with our community partners is that it came as a result of our deep partnership with our local community organizations between HIMB. And it was actually the community that really invited HIMB to become a part of this partnership to propose a NER, they're called NERs, NERR, in the He'eia watershed, in the Ahupua'a of He'eia. And the focus of it is also unique because, unlike many other research reserves, the idea is not to go back to some pristine environment that we actually know now is probably not attainable in our current modern living environment, and through a lot of challenges that system has already faced. But the focus was to restore indigenous resource management. And so this He'eia Ahupua'a piece of that, including HIMB, which serves as the administrative lead, is really leading that effort and this idea of cultural resource management and biocultural diversity. And we are just a partner. We are the administrative lead, but like I said, we really actually take our cues from our community partners, who we view as the leads of this. And I think because this program was so embedded in the community and distributed among many partners, during the pandemic, we actually able to continue that work. That community work was already happening in all of those distributed locations, and they were all doing their important work. And so that program actually has been very resilient in itself, while actually working on resilience of an ecological system.
That's great. Well, thank you so much, Judy. I'm going to ask you to hang on in the green room, as it were, so that we can kind of come back together and chat, all of us, a little bit at the end. Thank you for your work. Sorry to interrupt your sabbatical.
It's my pleasure.
And we'll see you back in a few minutes. I want to turn now to Lee Buen Consejo Lam and turn back to the healthcare sector, where UH has had a really visible impact, really throughout the Pacific and in Hawaii for decades, through the medical school, also through nursing and dental hygiene, public health, and other programs. But we really saw this come onto center stage in the pandemic, just how important UH's role is in public health, medical service provision, research, and the full range of health sciences and services. Dr. Buen Consejo Lam has really been at the center of that. She's a UH alumna, a family medicine doctor, a cancer researcher, JABSOM's associate dean, and she's been serving, which is on top of all of those other jobs, as UH's liaison to the Hawaii Emergency Management Agency and as our kind of overall point person on vaccinations. So thank you for taking time out of what must be one of the busiest schedules in Hawaii to talk with us for a moment. Nice to see you again.
Thank you for having me.
Like the others, I would love to hear just a little bit about your own research. I think it has mainly focused on cervical cancer in Hawaii and on other Pacific Islands. Is that right?
That's part of it, yes. So
okay.
Along with Dr. Neil Palafox and our team here at JABSOM, really, which comes out of the Department of Family Medicine and Community Health, and then more recently in partnership with colleagues at the Cancer Center, we have been working with the US affiliated Pacific Islands for over 20 years. And it's really to help build capacity within their public health and hospital to address cancer comprehensively. And so our programs are funded by the Centers for Disease Control, and it's something called Comprehensive Cancer Control, which really helps to build community and healthcare sector partnerships to influence the entire spectrum of cancer, from prevention all the way to treatment and survivorship. And so we've been doing that since about 2000. And then also with anything you want to do with cancer, you need data. And so we have set up and helped to implement a cancer registry for all of the US API jurisdictions. And I'm currently the PI for that. And we've had the regional cancer registry since 2007. And that's been in partnership with all of the departments of health, as well as the University of Guam. And then with cervical cancer, doing some exciting work as the technology has changed. The technology for screening has changed, and the increasing recognition that not all parts of the world, or even the country or the state, have good access to pap smear screening, which is that normally you think of, there's some newer technologies. And so, the team, now I'm kind of busy doing other stuff. And so I'm not quite as involved in that, but the team, which includes colleagues from the CDC as well as Australia and others, are really working to look at self-testing using HPV DNA in a couple of the jurisdictions. So yeah, wow. lots of different work, but it's all community-based and participatory, and much like what Judy just spoke about, right? It's really important for us as the academic center, when we're working with communities, it's very important to listen to what the community needs and to work with them to try to figure out how to help that, but really to build their local capacity, because that's how you're going to help long-term sustainability, is if they can learn to do this work in the context that's appropriate for them.
How was your personal research, or those of your closest collaborators, impacted by COVID, and how much has it been reshaped by the pandemic?
Yeah, so, I must say that it was that the issue of internet connectivity from the US Pacific has been a huge challenge that, has really, the challenge is not strong enough of a word. And our colleagues at the Social Science Research Institute with the Pacific Basin Telehealth Resource Center, also TASI, previously known as PSAT, they have been working with the Pacific and have again, for over 20 years. And it's fortunate that many of the jurisdictions that got better access to the internet, broadband connections, and in some of it, it's, still not what we see here in Hawaii, but it's definitely better than 28.8 dial-up speeds, which is what it was like about, 6 years ago. And so some of those things were put in place, and thank goodness, because we had to shift a lot of things to Zoom, but, there's just a lot of technological challenges, and you can only get that, from within the hospital. Many of our colleagues actually don't have internet or fast internet at home. And so it's been difficult to meet. And then, the type of work that we do, like with many of our colleagues throughout, Manoa, it's community-based, which means face-to-face, right? These communities are relational, and it's a little bit hard to do that with Zoom, but the good news is we've gotten into a rhythm and have regular meetings. We've actually held 2 pretty large regional meetings with Zoom, and there's ongoing education and whatnot. So it's and that will stay, thank goodness. But there continue to be need for face-to-face, and some of the jurisdictions are still closed, to visitors, and others were open, but then had to close again as they had surges, in August and September, and so travel remains a little bit of a challenge.
As Michael was saying earlier, when it comes to COVID in Hawaii specifically, so many units at so many faculty, so many graduate students, so many whole units have really pivoted to focus a great deal of energy on addressing the public health crisis of our time. But it's been a whirlwind too. So I think it's worth now beginning to look back at some of what we have tried to do or accomplished, and it's too early to have a retrospective. But as you start to look back, what do you think are some of the contributions that really stand out? From early on contact tracing and testing and as we move forward.
Sure. So UH's involvement with the COVID response actually started with a concerted effort in April 2020. So if folks recall, March 1 was kind of when we started to see more cases. The hospitals had begun their planning, trying to account for supply chain issues with PPE and keeping everyone safe. And so, the hospital started doing that really from late February, but from March, that first week of March, we had a lot of discussions as a medical school, had a lot of discussions because we knew that at some point this was going to disrupt our learners because of physical distancing and other kinds of things. And then, of course, back then, right, we didn't have a whole lot of information about COVID. And so the information that we were going on at the time was based on the best available evidence, which is what was coming out of China and a little bit to Seattle, Kings County. They had already had the big long-term care outbreaks and starting to see a huge death toll, et cetera. And so fortunately, because our UH's faculty are pretty well networked, then some of our colleagues from within the medical school, but also within public health, really started reaching out to other colleagues on the mainland. Boston and San Francisco, and Seattle were the particular hotspots at that time in February. And so very early on, we started figuring out what might be, the most appropriate protocols. And this includes pivoting to telehealth, seeming like instantly, but really a 2-week pivot to go from almost no telehealth to 100% telehealth. But that was just the beginning of March. And then the Hawaii Emergency Management Association's ESF 8, which is the one that is for public health and healthcare, was officially activated in April. And so we had folks from the UH system, Dr. Amy Grace, and Christina Higa, and those from the PVTRC, Dr. Chris Qureshi, from School of Nursing, and many others. And, of course, Dr. Victoria Fan and her entire group with modeling. Dr. Thomas Lee became quickly the lead modeler with HIEMA and was actually deployed to HIEMA for a while. And then, as the response grew, then we had folks from the Applied Research Laboratory participate, Dr. Withy from the AHEC, who does a lot with physician workforce. And later we had colleagues from our Department of Native Hawaiian Health to join and, make sure that we actually had some representation from the communities that were being most impacted. So that's just a sampling. And then, of course, UHERO and, work that, Dr. Carl Kim and many others have been doing. And so it's really been, really all of the health profession schools, medicine, nursing, pharmacy, College of Pharmacy in Hilo. Dr. Carolyn Ma was there and everything from the beginning and continues to be, she's the Dean of the College of Pharmacy. Public health, social work, several of us did as part of a subgroup, did a needs assessment looking at kind of organizational needs, and then later on in September at individual needs. And some of that was just released in a special issue of the Hawaii Journal of Health and Social Welfare, really kind of looking at the impact that COVID would have on individuals and on organizations. So just a lot of great UH effort. And then there's the contact tracing program that, we've heard about. And what you also don't hear about is that colleagues, respiratory intensive care unit specialists were working with our College of Engineering and trying to look at ventilators and trying to prepare us, if the worst case scenario happened, was it safe to put 2 people on a ventilator and, other things like that. So, yeah, so just, and then
my own high school daughter has been involved in the ventilator project, a different one, a remote sensing ventilator project, but with the same people.
Yeah, same. And so it's just really amazing. And, engineering printed masks for us. I mean, it was just really, and then the folks from the theater group helped sew masks. It was just really an amazing, wonderful, testimony to what we can all do together. And then working, with the state and a lot of the masking groups that came out to help make sure that masks could get to to those that are most vulnerable. A lot of them are UH faculty. So again, just a lot of tremendous. We should have a lot of pride in I think how we have contributed and continues to contribute to this response.
You mentioned the kind of health equity issues surrounding the pandemic and how some communities have been much more affected than others. Pacific Islanders in particular, and the ways that UH is now kind of trying to pull together different kind of coalitions of community leaders and stakeholders to, on promulgating good vaccine information, for instance. We've done, in terms of hitting vaccination targets, we've done quite well compared to other parts of the United States. But it's still been a slog. I wonder do you feel like there are things we should have done earlier to kind of make sure that we ensured vaccine availability, or we're providing good vaccine information to to kind of niche information markets that we've learned now as we're going along? Right.
So I think the coalitions with the communities actually started way back in July of last year, and which some of us feel was still just a little bit too late because the Pacific Islander population was still being they were slammed back in July, right? They had the highest incidence. They represent only 4% of the population, and yet at that time, I think at the peak, represented about 31% of the cases, and disproportionate amounts of deaths. And now, unfortunately, now it's gotten lower, but it's high, very high in Native Hawaiians and Filipinos, right? So, but since the very beginning, the Pacific Islanders, Native Hawaiians, and Filipino population have had disproportionate impacts, both in terms of getting COVID, but also being hospitalized, and then unfortunately also in dying. And this is when you look at it kind of per capita, so compared to the population, as represented across the state. So I think one of the things that could have been done better, and I hope will stay in place, is that mechanism for true community engagement, but truly not just us outreaching to whomever, but making sure that community is truly a partner, that the right leaders are at the table and really engage in active problem solving. Because until the Pacific Islander and Native Hawaiian communities were organized and doing that, they had to organize first. And then the coordination, the better coordination with the Department of Health started after. So I think, going forward, that's definitely one of the hard lessons learned. But because that network had already been established, and also with the Kupuna, there's a Kupuna Coalition and other things, they actually really started very, very early in November, like all the rest of us, right? And thinking about targeted messaging. And so everyone has been trying, and so many folks working with communities out in downtown Honolulu and also on the Leeward Coast, and so I think a lot of it also is that misinformation and social media and a bunch of other things that have made it really, really challenging. I think working with the churches has definitely been tried. So again, all of these great community engaged strategies and getting the youth to record videos and make it really, that has all been being done since November of 2020. And so now it's this really last pocket of folks who are actually not liking the mandates either, right? And it just continues to be really, really challenging. So wouldn't do anything different except to maybe start earlier and to maybe have a little bit more funding available so that you can have you have to buy social media presence, and CARES funding and all those things made it a little bit complicated to really get the funds out so that you could actually buy that social media time and combat much of the misinformation that has come from social media.
Fair point. One area we've done quite well in terms of meeting vaccination targets is within the university itself. And I just wondered if you might, and by the way, I'm going to call everybody else up onto the screen here in just a moment. But as a final question, just for you, Lee, what's the update on where we stand in terms of UH faculty, students, and staff in terms of vaccination rates?
Yeah, so the great news is, first of all, just kudos to the entire IT team at the system, Vice President Garrett Yoshimi and his team, and then, Vice President Hei Okimoto in terms of students. And it's just what UH has been able to do is amazing with the Lumicite UH, which is also why Michael said we can actually guarantee that the football stadium and our other venues will be safe, because we actually are able to verify, like for real verify, whereas many places are really not able to truly verify. So gotta have a huge shout out to the whole team. But for as of this morning, the students who are on campus, at least once a week, right? Everyone's required to do the Lumicite UH and to upload vaccination cards and or be submitted to weekly testing when they're on campus. So overall, across the whole system, we're at 85% have a vaccination record, and the rest are submitting weekly tests when they're on campus. But for Manoa, it's 91%, which is wonderful. And so that's really, really high. And it's also really high for the faculty and the employees, although we don't quite have those numbers just because Lumicite also, which is an advantage, We require all of our visitors and our contractors to do it. Again, which just has so many layers of safety here. But from a data sorting point of view, it's just a little hard to get those numbers, but it's very high. And then hopefully everyone saw the article today that, our UH Manoa modelers did, the pandemic, applied modeling group did, that shows that this high vaccination rate really has contributed to helping keep the numbers down. And so I think we can be very proud of that number.
Well, let me invite Michael and Judy to come back on and join us. We're going to tip just slightly over the hour, but not too much. Michael, I guess I first want to ask you to join the conversation with Lee, if there's any, as we begin to hopefully start to look back at the pandemic, are there any hard lessons you think that are important for the institution to take to heart to make sure that we're ready for any future crises, adding on to what Lee had said?
I will say that, and I know Lee would agree with me, we have weekly meetings with an incredibly diverse set of people from across the entire university system. And I think both within the Manoa campus and the various units and also throughout the system, I believe that the relationships that have been developed are going to be with us forever. I think that there will be levels of collaboration and partnership on campus in the life sciences, the medical sciences, that would not have existed without people really coming together in a crisis and working so well together.
Okay, well, I just want to close, I guess, with the same question for all of you, which is that I think it's long been true, if not always discussed, that the university plays an absolutely vital role, not just in educating our students, not just in generating knowledge, but in solving community problems and just engaging with all sorts of community organizations and, trying to make the health and sustainability and the overall well-being of our islands better. But we've had a real special, intense taste of that during this public health crisis. And my question for you is, looking forward beyond the pandemic, 5 years from now, how would you like to see community engagement and education grow as we move forward? And I'll ask you first, Lee, and then Judy and Michael will close out with you.
Sure. So I think that UH certainly has a lot to offer, not only with the other state or county organizations, but also with the community. And so we have many programs, especially in the life sciences, that work with the Department of Education to help with teachers, help prepare the teachers and STEM education, other kinds of things. But I think there's a lot more that we can do with that. And so it's certainly not just STEM education, but with really almost everything else that UH, I think the more that we can meaningfully engage with all sectors of our community, the better it will be, because it's really going to take all of us to help, to very thoughtfully and very resource appropriately address whatever the future throws at us.
Judy, what are you've been doing this, as your primary job, community engagement, for a long time. Where would you like to see us be as an institution in all of these areas?
Yeah, well, first, I want to agree with Lee. Excuse me, I think what she just said is right on the money in terms of engagement of communities. One of the things that I think UH actually does well, but could continue to develop, is this idea of not just sharing knowledge, but leadership. And I think within UH, there's actually a good amount of that. I was, as Lee and Michael were talking about their meetings, they had daily meetings being, in the thick of the medical discussions that were happening in COVID. But as someone that was trying to run a research institute during that time, the weekly meetings that we had were incredibly helpful and actually was way ahead of what we were actually getting from other sources, both within the state and even sometimes the federal government. So that I really appreciated that, and I think that that sort of knowledge is something that we can take further into our communities. But also thinking about this idea that there's the Hawaiian Olelo no Eau, all knowledge is not taught in the same school. And so not just being holders of information, but sharing that information, but also sharing the capacity for that leadership and being real partners in the community, I think is something that I'm looking forward to.
That sounds like leadership and listening. Okay, Michael, last word to you.
Well, I was just listening there. Yeah, my two colleagues put it really well. And I really think that our success in strongly supporting the community has built or created a level of trust and trusted partnerships, collaborations that would not have existed otherwise, and that we, to both points, I think we need to keep at it. We need to make sure that those trusted relationships continue, and I think they will. And part of the reason I'm certain that they will is what Judy just alluded to, the groupings that we assemble to get us through the pandemic in all of the areas that we work, those relationships between faculty and staff and administrators, working so much more closely together than ever before. I think that is permanent, and along with it, those relationships that they bring to the external community. I think it's permanent, but it's something we're going to have to, I think, from our positions, keep at.
Thank you very much. Thanks all of you for joining us, for your work, really, but also for your wisdom and words with us today. So thank you also to everyone joining us online. Thanks to the Hawaii Book and Music Festival. If you haven't looked at their full program events, it's full of UH faculty, by the way, as well as amazing authors and musicians from around the world. So take a look and sign up for other programs. Thanks to our little production staff and all across UH units that make this possible in UH Foundation and UH Communications and ITS. Thanks so much for all your help for making these conversations possible. And we look forward to speaking with you all and sharing ideas again soon.
Thank you.
Aloha.
Thank you.
Aloha.
Thank you, Robert. Thanks, everyone.
care.
Bye, everybody.